So now let's come to the next segment. How do we detect breast cancer early? To detect breast cancer early, first let us understand, are there any early signs and symptoms of breast cancer? And how do we detect these early signs and symptoms? So first, let us go to what are the symptoms of breast cancer. The symptoms of breast cancer are definitely not pain. Many women come to us very scared that they have breast cancer because they have pain in their breasts. The pain is a normal physiological occurrence in most women. Premenstrual pain, tenderness and lumpishness, that is a lumpy feeling in the breast just before menses, is a very common finding and a common symptom. This is not a symptom of breast cancer. Thus, pain is not a symptom for breast cancer. So then what are the early symptoms? Early symptoms could be a lump that is felt, a painless lump that is felt in the breast, nipple discharge which is red or clear like water, an ulceration on the nipple or an excoriation on the nipple that is like an eczema or a skin rash which comes on the nipple, could be an early sign of breast cancer. Coming to nipple discharges, if you look at after having palpated your breast, squeeze the nipple areola and look for discharges. You may find a white discharge, you may find a greenish discharge, a dark brown discharge. All these are normal discharges and need not be investigated. Very many women might have these discharges without having any disease in the breast. If it is a clear watery discharge or it is a red blood colored discharge, only then does the woman need to be careful and go for an examination. And again, most of the times even these are due to benign tumors in the breast and not due to cancer, but cancer needs to be ruled out. Then the other symptoms that you need to watch for when you are examining your breasts are nipple retraction. As you lift your hand above your head, you may find that the nipple has gone in and there is a tethering or the nipple is withdrawn. Sometimes there may be a permanent tethering of the nipple, and this is an early sign of breast cancer. Sometimes you may see part of the skin getting withdrawn, and that is again a sign of breast cancer. Then coming to the nipple, you may have a excoriation of the nipple or an eczema of the nipple or a rash of the nipple, which goes away automatically or with medicines that your skin specialist prescribes. However, if this rash persists even after treatment, this could be a sign of early breast cancer. And then ulceration on the nipple is again another sign of breast cancer. And finally, an orange peel appearance, that means the skin is very thickened and looks like an orange peel, is a sign of breast cancer, which is not an early sign but a late sign of breast cancer.